the Toronto Star. I'm Saba Itazaz, and this matters. The scientific marvel of inventing COVID-19 vaccines. That was supposed to be our big moment. Instead, the inequities exposed by the virus have rolled right into the vaccinations. Essential workers, low-income families, racialized communities, data has shown those are the ones filling up Ontario's overflowing ICUs. Virus variants are far outpacing vaccination. Wave 3 is not slowing down. The Ontario government has claimed to shift vaccine focus to highest-risk postal codes. But if you're between 18 and 49 and living there, you might find the ground reality quite different.
I have to tell you that 2.8 million people didn't find it confusing. It's very, very simple.
Let's take a look at all the ways this is anything but simple. Increasingly, private citizens have been trying to fill in the gap and help people navigate the vaccination messaging and the booking system. So let's have a talk with one of them. Later on, Star reporter Olivia Bowden will join me to explain why those with better resources, access, and means might still be the ones with a better shot. Right now, Ray joins This Matters. He's part of a grassroots initiative from Markham to get vaccine access for residents. Hi, Ray. Thank you for joining me on the podcast today.
Thank you for having me.
So tell me a little bit about the work you and other volunteers in your organization are doing, and why did you feel like you needed to do that?
So we'll start off with who we are first. Markham and Stouffville Vaccinates is a entirely volunteer grassroots initiative that aims to lower the barrier for seniors 65 plus in Markham and Stouffville to get their vaccine appointments and also physically get some of these residents who don't have cars or have mobility issues to their vaccine appointments here in Markham.
So Ray, what's this time been like for you in the community? Has the vaccination rollout and the consequent announcements and the booking system been difficult to navigate? Tell me more about how your community members are struggling with some of this.
Well, the entire impetus of this initiative started off because it was so confusing to understand anything about the vaccination strategy. In late February, so the other co-organizer, Reverend Nicholas Skinner of Grace Anglican Church, she wanted to have a list of all of her seniors 80 plus to get appointments for them, because at that point, the news was everybody 80 plus should start booking appointments, but there were no mechanisms. And throughout that last week of February, there were some very conflicting announcements made once a day, every day, for a whole week. We started off with everybody's going to start booking. And then there was no provincial booking system available the next day, followed by, we're going to have it available on March 15th. So we got together and we thought, if we can't make heads or tails out of it, how can we have an expectation that seniors, 80 plus, who are now being asked to book exclusively online or on a telephone number that most likely will crash on the first minute of the first day, which it did, how could they make sense of it? So what started off as an initiative to get parishioners inside a single church kind of exploded within 36 hours into an initiative to get everybody in Markham who needs help to get them the help they needed. So within 36 hours, we launched the site, we put a database behind a web form, and we started signing up seniors. Within the first 3 days, we had 72 seniors signed up, and within a week, we had a couple hundred. We're at 3,000 plus now, and 2,500 appointments booked. And that goes to show that there is inequity. There are barriers because we can't just assume all seniors can log onto their Chrome browser and be able to click 20, 30 times to find available appointment. People don't have the patience or the technical capabilities for that. If I, as a fully functional 39-year-old, can't make heads or tails out of it, if I'm a fully functional 39-year-old software consultant, and I'm having trouble with the 4 or 5 different systems at one point that I can book seniors into, the expectation for seniors whose jobs aren't software consultant to do the same thing is just outlandish.
Is frustration building up? Are you getting a lot of irate calls because of these constant changes in the messaging? How are people feeling?
So if I were to rewind 2 weeks ago, I would tell you everybody's happy, so happy that we're able to navigate for them because they couldn't navigate it themselves. A lot of these seniors couldn't navigate it themselves. A lot of people who are very grateful, relieved. But within the last week, since last Thursday, when Doug Ford announced that in a 15-minute time span, all these things that people are now latching onto. I'm a teacher. I'm eligible for a shot. I'm 18 plus in a hot zone. I'm eligible for a shot now. I'm immunocompromised. I'm eligible for a shot. And they reach out to me because I have apparently accidentally become the vaccine appointment authority here in Markham and Stouffville. And I'm happy to answer their calls because I want to help. I've struggled with community volunteering since the pandemic started, as you can imagine. I mean, I can only volunteer around these four walls in my basement. But now, given the opportunity to make a difference, I'm going to, and I'm happy to make the calls. But you said an interesting word. Are people irate? Well, I think they are. And sometimes their frustrations and anger are misdirected at me. Because last Thursday when that happened, I received over 100 calls, emails, texts, Facebook messages, next door posts. Next door is a thing. And for the most part, by and large, everybody is very understanding of all the details I'm trying to provide them, because in the morning, there were no details. At the press conference, there were some things announced, no details. And even up until after that, like 6, 7 p.m., there were no details. I'm trying to cobble together information from all these different sites, official information from government sites and unofficial information from news agencies. I'm trying to cobble them together to give answers to people. And people are frustrated because I can't give them the answers they want to hear, or I can't give them answers at all.
Well, hang in there, Ray, and thank you for the work that you're doing. And thank you for speaking to me in the middle of all of this that you're working on.
Thank you for having me.
I was talking to Ray Lai, a community volunteer from Markham. Star reporter Olivia Bowden is here now to help us better understand vaccine inequity and why the people who need the vaccine the most aren't able to get it. We'll be right back. Hi, Olivia. Thank you for being on the podcast again.
Thanks so much for having me.
So, Olivia, first we saw this terrible, tragic truth of the inequities of the virus, and we saw who it was affecting the most. And now we're seeing, in a way, the inequities of the vaccine rollout. Let's talk about that first. What do we mean when we say vaccine inequities?
So, what we're really talking about when we describe vaccine inequities is that, the people who need the vaccine the most are not the ones who have been prioritized to receive it. And they're essentially being vaccinated at a lesser rate than people who may not need it as much. So people who are generally not as at risk as many of the people who are.
And the province has announced last week that they're now focusing on these hotspot postal codes, and they're trying to amp up vaccine outreach and eligibility efforts as well. Can you give some details on that? And what are people saying about how that's going so far?
So yes, we heard from the province that they were expanding the rollout to ages 18 to 49 in hotspots. People 50 over can still get vaccinated in hotspots right now, but they had expanded it to all adults. But the thing is that, if you're between the ages of 18 and 49, you can't go to the province's website and sign up right now. And you can't really go to any specific hospital and do that. It's very patchwork. Some places like St. Jamestown are offering, vaccination for those ages right now, but it really, really varies. And they said that, it may end up being through, your faith community, a community organization, or your employer. So you're kind of just left sitting if you're in one of those hotspots.
So a lot more has to be done, and there's a lot of confusing messaging flying around, and we will get into the details of that. I know you reported on one of the hardest hit neighborhoods of Jane and Finch. Tell me a little bit more about the residents that live there, the demographic, and how that plays into what we're talking about in terms of vaccine inequity.
Sure. So, Jane and Finch is a neighborhood that's majority immigrant population. So it's close to 60% of the population identify as immigrants. Over 80% of the population identify as people of color. And these are all above the average for Toronto as a whole. And there are also more essential workers in Jane and Finch. So, Jane and Finch as a neighborhood, it emerged because people from these groups were already pushed out of the city over the last couple decades. they're sort of relegated to the northwest corner of the city. And then that area has faced consistent neglect from governments for the last several decades. And this is nothing new. This has been reported. This has been reported by community associations. So people in those areas face health disparities, and some of those are connected directly to racism. So, they're facing all these different types of health issues in that area.
And Olivia, you spoke about Andrew Doe and his parents in your piece, which seems to be a perfect example of how residents of certain neighborhoods have always been treated by the health system and the systemic barriers they face. Tell me more about this family.
So Andrew is in his early 30s, and he grew up in the Jane and Finch neighborhood with his younger brother and his parents. And his parents came to Canada as refugees from Vietnam, and they landed in Jane and Finch that has, a fairly sizable Vietnamese population, and it also has a higher proportion of refugees than other parts of Toronto. So this is definitely, a landing spot for many people from this type of background. So, his parents have always had to take jobs like factory jobs. His dad currently works in a factory, and this is a situation where his dad was an essential worker. So, Andrew talked to me about the barriers his parents are facing to get vaccinated, which are the same issues I've heard from many, many residents from the northwest area of Toronto for the last year. So first of all, English is not his parents' first language. And if this vaccine system is confusing for people who speak English, it is so much more confusing if you are not super comfortable with English. And, this is Toronto. It's known for its diversity. We talk so much about how we're proud of our diversity here. But in terms of really reaching people who aren't comfortable with English, the current Ontario platforms do not have that, translation ability right now. So, first of all, that's one issue. The other issue is that neighborhood does not have too many places to get vaccinated in the first place. So, you have a couple of pharmacies where AstraZeneca is being administered. They're all on different corners of the city. You're going to have to take some transit to get there. And if you're working, shift work, finding the time and ability to get potentially across town to get the vaccine is tough. And if you're under 55, there's really only a couple places. Some other ones have sprung up through community associations. But, unless the vaccine's being brought to you, it's going to be very difficult for you to get there. And, a lot of these workplaces don't allow you to take an hour to go to a medical appointment.
Yeah, that's what I was going to ask you about, because they're talking about a lot of pop-up clinics, a lot of additional pharmacies in areas which were previously considered vaccine deserts with not enough pharmacies. But how do you get essential workers to be able to afford that time off to go there and to stand in queue and to be able to get that, right?
Right. No, this is definitely an issue. And Andrew told me that, his dad really doesn't want to blame the factory. But, Andrew says that his dad is in there 40, 50 hours a week. The workplace had an outbreak, and his dad does not have sick days. So he's in the process of helping his dad apply for CRSB, which is retroactive pay if you get COVID. But this obviously, didn't stop anyone who may feel a little sick from coming to work. And it put his dad in an unsafe environment. And his dad, he's proud. He doesn't want to ask his sons for money. He doesn't want to ask his sons to pay their rent, even though Andrew told me, he's frustrated. He doesn't want his dad to go back to work. He wants to pay his rent. But, his dad is all about a strong work ethic and taking care of your own self, which I think, a lot of us who have families from immigrant backgrounds can really understand that and where that comes from. So his dad, really insists on paving his own way. And to pay their rent in their Jane and Finch condo, the wages are not nearly enough. So if you look at the average wages for Jane and Finch residents, it's about $25,000 a year per person. So, a single household could maybe just scrape by on rent, and that's average. So if you don't have sick days, you don't have a choice. You have to go to work.
So that kind of plays into the problems with the vaccination rollout as well. Can you walk me a little bit through the current vaccine booking system? What kind of obstacles would older people, especially immigrants and newcomers and refugees, come up against while trying to book a vaccine appointment for themselves?
Sure. So already how to book an appointment is spread out through multiple different platforms. So first of all, you need to know what public health unit you live in. You need to know what the qualifiers are in that area. So it may be a hotspot, so maybe it's 50 plus. Maybe it's not a hotspot. Maybe it's only 60 plus, and sometimes it's only 70 plus because of a vaccine supply. So you need to figure that out, and that can take some Googling. And I know for me, it takes me a couple of times to find the proper landing page for a public health unit. So you need to be able to navigate that first of all.
And you also need to have access or knowledge of technology, or have a smartphone, or have access to a computer.
Right. So you need consistent access to the internet, and you need to be aware of all these layers, like, public health unit. A lot of people I speak to understandably don't know what public health unit you live in, because just because you live in a certain city doesn't mean that that city could be part of a different public health unit. And then, if you register, you need to be watching your email. You need to be making sure that you hit it right away in order to register. And then, another thing many physicians who work with specifically majority immigrant communities is many people are not comfortable interacting with the healthcare system in the first place. They're not used to going to the doctor before this pandemic. They're not used to, interacting with institutions in that way, because those institutions, like our healthcare system, are not set up for people who are not native English speakers and who have other cultural considerations. So culturally relevant care is not a part of our healthcare system, and it really dissuades people from interacting with it. And they may not have a family doctor. So, if you're not used to, going to the doctor all the time, phoning these numbers, signing up on these websites, to do a much more difficult layered process with this, it's going to be a whole other hurdle. And, Andrew talked to me about his whole life. He's been translating for his parents. He's been dealing with bureaucracy since he was in elementary school to ensure that, they filed things, they signed up for things. And he said that that's a really, really common experience. And that's not on the families, that's on our system for not making this easy for everyone who comes to Canada.
And that's what I've been seeing in tweets from people who've been helping their parents or their grandparents trying to navigate the bureaucracy. And I'm thinking, how many elderly people in an area like Jane and Finch, for example, would have been able to book a vaccine without the help of their children or grandchildren? It's not a self-sufficient system, it appears.
That's the thing. I don't think they would be able to. And also, that area of Toronto also has a higher percentage of homebound seniors than the rest of the city. And I believe it's 20% of Ontario's homebound seniors live in this part of Toronto that is already facing vaccine disparities. So you're having people who are over 70 who the vaccine has been available to for weeks, but they haven't gotten it because, if you live alone and you're a homebound senior, if someone doesn't bring it to you, how are you supposed to figure out that, there are numbers you can call with the city to get transportation, but you have to figure that out on your own rather than the services coming to you? And this would all be so different if the onus wasn't on residents to figure this out.
And I know you've been tracking this vaccine rollout and how people can get them as well. Any updates or advice on that? Any resources that you can point towards for someone who is in a highly affected area and looking to get vaccinated?
Right. I know it's really tough to figure this out, and even me and my colleagues. So we have a chart on the STAR website that's free to everyone. You don't have to be a subscriber to check which public health unit you live in and where to get the vaccine. And we update it every day, including the links for hotspots. So because we are updating that every day, I would definitely recommend checking out that webpage. Otherwise, if you're in a hard-hit area, I would recommend reaching out to your community association because they're likely the first to know. And with hotspot communities, foreseeing the vaccine rollout, to be with local community clinics, mobile clinics, or potentially, at places of worship, I would definitely connect with them on that as well.
You've been very insightful, Olivia. Thank you so much for being on the podcast again.
Thank you so much.
I was talking to Toronto Star reporter Olivia Bowden. That's it for today. Thanks so much for listening. This Matters is hosted and produced by me, Sabai Tazaz, Adrian Chung, and Raju Mutter. Produced and mixed by Sean Pattenden, and our director of programming is JP Fozo. Our show theme music is by So-Called, and our episode music is by Mike DeAngelis. We want to hear what stories matter to you. Please send us comments, questions, or ideas to thismatters@thestar.ca. Please consider supporting the journalism the Toronto Star newsroom does at thestar.com. And don't forget to subscribe to This Matters on Apple Podcasts, Spotify, or wherever you listen to your favorite podcasts. Let's talk soon.